This is a review of Daniel Hogan's 2017 guidelines on feline cardiogenic arterial thromboembolism, prevention and therapy. Feline cardiogenic arterial thromboembolism, or CATE, refers to a disease that starts as a thrombus typically in the left atrium and then migrates to cause infarction in the terminal aorta. The predisposing factor for thrombus formation is some sort of cardiomyopathy, typically hypercardiomyopathy, but any form can be present in feline patients. And progression of heart disease with two other factors can lead to clinical signs of CATE. The first of which, blood stasis, is due to cardiac remodeling as a progression of the underlying heart disease. As left ventricular disease progresses, ventricular filling is compromised. This results in left atrial dilation, which ultimately ends up with dysfunction of the left auricle. Because blood is able to stay within the heart across contractions, there is opportunity for thrombus formation to occur. Unlike cardiomyopathies, which are routinely diagnosed in feline patients, there is no evidence of a true hypercoagulable state in cats. However, feline clinical thrombosis is associated with increased platelet hypersensitivity, factor VIII and fibrinogen increase, and decreased antithrombin and protein C activity. For this reason, review of the coagulation cascade is appropriate for understanding the mechanism behind available therapies. Finally, endothelial injury sets the foundation for thrombus formation. Damaged endocardium exposes subendothelial collagen. Adhered platelets are activated by von Willebrand factors. There are two categories of molecules released. Pro-aggregating molecules attract fibrin, which drastically increases the size of the thrombus, while vasoconstrictive molecules constrict neighboring vessels, increasing the likelihood of infarction. It is the combination of these three factors, the vascular endothelial damage, the blood flow stasis, and hypercoagulability of the blood, that increases the risk of thrombosis. Three factors, together, have been referred to as Virchow's triad. The majority of cats who suffer from CATE will experience a terminal aortic infarction, commonly referred to as a saddle thrombus. If we were able to look inside one of these cats, we would see the embolism is occluding blood flow at the level of the aorta where the limb's arterial blood supply originates. And looking inside the cat is critical because what we can't see is a particular gender or reproductive status or breed that is a predictor of having CATE. Instead, an opportunity for an echocardiogram to identify a larger atrium, either in terms of total size or ratio to the left ventricle, or any cat with spontaneous contrast or smoke present in the left atrium. Often, the first sign of atrial thrombosis doesn't present until the embolism results in a saddle thrombus and the cat develops severe hind limb paresis or paralysis. But occluded blood flow to hind limbs can also manifest as firm, painful, cold limbs. Pulses can be decreased or absent, and nail beds can be blue. Roughly 10% of cats will have a brachial embolism, and due to feline anatomy, it is typically the right pelvic limb that is affected. Less frequently, the embolism can migrate to arterial blood flow of other organs, and acute onset of pain is associated with organ-specific dysfunction. Additional exam findings may include generalized hypothermia due to disruption of blood flow, as well as abnormal heart sounds and electrical conduction associated with underlying heart disease. Congestive heart failure is inconsistently documented, but its presence can influence the therapeutic protocols selected. And of the concerns to be considered prior to initiating therapy are those that can result in reperfusion injury. This concept of reperfusion injury refers to a situation in which cells have died and the intracellular components are released into the extracellular space. The absence of regional blood flow allows for localized elevations in potassium and acids, and when the region becomes reperfused, they enter general circulation and the cat develops severe hyperkalemia and metabolic acidosis. There is always three categories of treatment options that must be considered during an emergency visit. Hogan argues that feline patients with cardiogenic arterial thromboembolism should not be euthanized within the first 3 days of clinical signs. He argues that while survival rates have wide windows, those that do can show partial to full recovery in weeks. In addition, multiple treatment modalities are available that frequently offer long-term quality of life improvements, short hospital stays, and relatively low costs due to the multimodal approach available. After all, one of the reasons why this mechanical obstruction can cause such devastating effects is because the platelets themselves are releasing substances which directly and indirectly constrict collateral vessels, which may have been able to provide sufficient support. Therefore, improvement of collateral flow is a primary goal of CATE therapy. Both clopidogrel and aspirin have been shown to improve feline collateral flow. Although aspirin has historically been a more cost-effective drug than clopidogrel, cats metabolize aspirin poorly, and therapeutic levels can be toxic. Therefore, its use is often reserved for when clopidogrel is not available or if the cat demonstrates that it is not responsive to clopidogrel. Next, while some cats will vocalize and exhibit behaviors that are suggestive of being in pain, others will not, and pain relief may be prescribed for the most stoic of cats. Meanwhile, supportive care is implemented during the critical phase of recovery. During this time, rectal temperatures may be low due to decreased blood supply, and it's important that thermal control be monitored carefully. This may include reliance on blankets over heat lamps, which may cause increased temperatures to necrotic areas, and access to fresh water, but not necessarily IV fluids, whose use is more appropriate for managing potassium, acids, and vasoactive substances, while constantly monitoring for congestive heart failure and possible fluid overload. Therapy intended to induce a hypocoagulable state is done so in order to prevent thrombus formation on the existing embolus and to promote thrombolysis. And anticoagulants like unfractionated heparin and low molecular weight heparin are commonly part of therapeutic protocols for both primary and secondary preventatives. Thankfully, preventative protocols are available for a variety of disease stages and financial concerns. And the phrase preventative protocol is appropriate because even with the best protocol in place, the best reoccurrence rates are still near 50%. Most cats who are diagnosed with thromboembolism will likely have another one sometime in their life. Now, there's one therapy that was not mentioned, and that was of surgery. Surgery is generally contraindicated due to the operative risks, and because cats' sizes are so small, non-invasive embolectomies can be very challenging. Therefore, it is generally recommended that antithrombic medications be started as soon as possible. Feline cardiogenic arterial thromboembolism is a terrifying disease for anyone that has to witness it, in any of its forms. And yes, while complications exist for even the best therapeutic protocols, therapy can be approached from a multitude of angles, and various preventative protocols have been developed depending upon the stage of disease or financial constraints.